Yeah, public sector, you all work in a very complex system. We know that many of you are going to be working in an organization where many of your colleagues are working in life and death scenarios, where you're working with challenging public facing roles. And also, we have to think about the external context as well within the public sector. More and more of you are doing more, having more demands put on you and less resource. And I was just happened to look at a paper yesterday for something else I was working on from the World Health Organization that found that where there's a mismatch between the amount of effort people are putting in and the lack of reward they get back in terms of maybe promotion or pay, which I think is very relevant and current to public sector, you're at higher risk of depression. So hopefully when I take you through what we mean by work-related stress and what HSC's requirements are, try and sort of give it that more flavour for you to maybe think about what you in your various organisations can do to try and minimise the impact of the working conditions as they are on your colleagues and co-workers. So we want to go to the next slide, Carl. So let's do definitions. I mean, we all probably talk about stress all the time when we mean pressure, but in HSC's book and probably the research literature, there's no such thing as good stress. You can have good pressure because we always need a little bit of a motivation to help, get us to achieve things. But if you have too much of it, it can be detrimental to both your physical and mental health. So we define work-related stress as the adverse reaction that people have to excessive pressure or other types of demand placed on them. And the reason that we take it seriously is that, as I said, it can impact on people's not only the psychological health, but also their physical health. So we go to the next slide. Okay. So let's put this into sort of more context for you. So if we, for whatever reason, and a lot of it at the time is we don't know what we do, we don't know what we don't know, and we might create unwittingly an unhealthy, unsafe workplace for our people to work in. We might put too much demands on them, maybe not give them enough training, maybe we're not giving them some respite if they've been in one of those very harrowing scenarios, and it's a recipe for work-related stress. So we know that when people are under undue pressure and experience work-related stress, you will see an increase in accidents and injuries because people lose their ability to concentrate. They might not be sleeping very well. You're going to have other work-related illnesses as a result. You might have other surveys that you complete where people show that they're just generally not satisfied with what's going on. And if you're in a civil service or public sector organisation, you probably see from your annual surveys that maybe people show an intention to leave within the year or within a couple of years. And that sort of lack of job commitment can then lead on to burnout and say the expression of depression, and sometimes people can hit out at colleagues, which is not a good thing to do. Now, all that then accumulates to sometimes we can then find ourselves accumulating very unhealthy work practices. You might smoke more, you might end up drinking more, you might start overeating, just generally becoming a couch potato. And that as well can then manifest itself in presenteeism, trying to keep going and keep working, and you're finding yourself a little bit like a hamster in a wheel where you're working harder and harder but not getting very far. People might be taking more short-term absences off, maybe a long-term. You have turnover, you can't quite explain it. You might feel like people are not as productive, but you can't put your finger on it. People are working really hard around you, but they're not just that productive. And over a period of time, because we know that various pieces of research that have been done over the years, there's one particular called the White Hole study, and they found that it can lead to coronary heart disease, diabetes, stroke, it's just not good for our physical health, but also, again, it leads to anxiety, depression. And in terms of just the bottom line, which I know some organizations are very interested in, if you're not having people who are being able to bring their best selves to work, you're not creating an environment where they can flourish, you will get that decrease in the quality of your productivity, and also more likely to get customer complaints. But also, when things go wrong, you're more likely to come under the scrutiny of the regulator, and we'll talk about that in a minute. So we'll go through the next slide. So this is the bit where I always find that it's quite interesting that people are aware of the Health and Safety at Work Act, because we all want to have a nice, safe, environment. No one should go into work and end up being made ill or worse as a result of it. But often in respect of work-related stress, in my experience, people don't realise that there's an expectation on you. Yes, you probably will be doing lots of really great stuff to look after your people. You've probably got loads of policies and procedures in place, but you will still have people going off sick. And you will probably, I imagine, all do a stress risk assessment, but only at an individual level when somebody has already gone off sick, come back, and you're having that conversation, say, well, what tipped you over? What do we need to do to bring you back to full speed? And organizations as a whole don't recognize that you have to do an organizational level risk assessment. Now, I know all of you have got very complex setups. You've got different pockets in your organizations that do different things and are exposed to different risks. Now, it doesn't necessarily have to be like a blanket organizational risk assessment, although I ought to sort of retract a little bit on that. You can do team level risk assessments or divisional or departmental level risk assessments, but feed that up to someone at the top who can actually get a good oversight of what's going on. But if you just rely on individual level risk assessments, you're not compliant with the Management of Health and Safety at Work Regs 1999. There's an expectation that you'll do organizational level risk assessment, and you can handle that, and we can show you when we do the demo of the stress indicator tool. You can handle that by doing departmental risk assessments. So somebody, let's say further at the top, has oversight of what's going on in the different areas of the organization. Then you're looking at who's like to be harmed and how, what you're doing about it currently, what more do you need to do? And that's what the inspector's expecting to see when they come down, and the activity will increase as time goes by, because this is a focus for us in HSE. Over the next 5 to 10 years, you'll see increasingly more conversations being had by inspector, whether it's a local authority inspector or they're like come and say, well, what are you doing to manage work-related stress in your business? If you have less than 5 people, you don't need to write it down, but there's still expectation that you have that conversation or you thought about it. Over 5 employees, you need to have a written risk assessment, and it needs to be a living, breathing document. We go on to the next slide. Okay. So back in 2004, world work changed back in the sort of 1990s. We moved more from a sort of manufacturing economy to more service-based. And there was the recognition that people were experiencing work-related stress. So HSE quite rightly decided that they needed to do something, be more proactive in that space. So they developed a set of standards that organizations could use to guide them to understand those elements within the workplace that, if not properly managed, could tip people over, could cause work-related stress. So these standards are demands. So that's things like how much work someone has to do, the workload, the scheduling, the physical environment, the amount of decision making that someone has. This is the control element. Can they do the work without interruptions? Is the amount of initiative they're allowed to use appropriate to their skill set? The support they get from the organization. Do you have the right policies and procedures in place, the right structure? Do you get support from managers and colleagues, both on a practical and an emotional level, but also in terms of relationships? How are those managed? Is any potential conflict dealt with there and then? Because we know that there's a huge issue around bullying harassment in most businesses. So it's about being proactive and making sure that people can work really well together. When we talk about role, a lot that's around, good job description, good hiring, good sort of setting the parameters, looking at the roles and responsibilities, making sure that work is properly dished out. There's a lot of transparency around that. There's no sort of ambiguity around that. And one of the areas then we do our work, we always find that change is never managed. So if you're trying to put a new initiative in, or someone says, right, we've got to change the way we operate, often we find that the workforce are not consulted, and if there's a gap, or people fill it with their own sort of thoughts of what's this going to mean for me. And particularly when we're thinking about new ways of working, technology, for instance, and we'll talk about the home and hybrid element of the stress indicator tool in a moment. That is not well managed. But we know, as I say, there is a set of standards, and these standards are the sort of underpinning for the stress indicator tool. If these elements all well managed, then you're less likely to have people experiencing pressure, stress, going off sick, not being productive. And it's all about creating a really good working environment. Next slide. Now, mentioned earlier about what people do in terms of a risk assessment, and I sort of said that most people tend to do that conversation, when they come back, and they might be dealing with that individual on a one-to-one basis. Now, our perspective, both legally and I think morally, it's the best way to do. We don't want to make people sick. You guys don't want to make people sick in the first place. And the only way you can do that is by prevention and looking at how your organization or your team or your group or department, whatever it is, how is it set up? How is the work designed? How is it operationalized? So we're looking primarily at people being proactive, putting in systems in place at an organizational level to make sure that it's done well. So that might be things like making sure that, in terms of your recruitment processes, that you have opportunities there for people to actually, you get a good fit between the person coming in and the work they're needing to do. We're also looking at secondary interventions, because those underpin your organizational level structural interventions, how the work is managed, through giving people the training and the awareness of, what do we mean by stress and mental health? Are we training our managers? And often, again, I find that when we do training courses, or we do the work with different sectors, people don't support managers. And you probably hear in the management role, and you probably have responsibility for people, and you've probably, been hired on the basis that you're great at your job. But when you think back, you've probably not had that much training to deal with some of the challenges that you have when you're managing other people. And also in terms of, if you could have 2 or 3 people going off sick at any one time, and you're still trying to do your day job, it's a huge burden for our poor team leaders or managers or leaders. So again, it's trying to make sure that if you're doing your risk assessment, you're looking at what else I need to put in place. One, to make sure it doesn't happen, the problems occur in the first place, by basically it's about good management. But then what am I doing to keep upskilling and training the people in the first place? Now, I should mention, I just realized that I'm not saying that individual risk assessments and the like are wrong, because there'll always be someone slipping through the net. Our focus obviously is in primary, secondary, but always want you to make sure that you do something, for the individual, but it shouldn't be the be all and end all. If I had 3 big bubbles, your biggest bubble of effort should be on the primary side, the organizational level, and the secondary would be your second biggest bubble, and a little bubble for your individual tertiary level. So we go on to the next slide. So thinking, okay, I've got risk assessment. How do I do this? How am I going to do this? Where's this stress indicator tool fitting in with this? Well, first of all, again, bearing in mind, complex organizations, all of you, how can you identify which part of your organization your people are going to be at the highest risk? And you might say, right, paramedic, yeah, definitely tick. That's going to be, they're going to be at risk because we know intuitively from the reports we get. But that would be part of the conversation that you would have at the beginning, that sort of identify the risk. Think about what is it, what's happening in your organization at all the different levels, all the different elements of your business. You know, who do you think that is going to be at the greatest risk? Then the number two would be, okay, what data you could collect. Now, the beauty of the stress indicator tool, when we've used it, what it does, it allows you to anonymously capture the views and opinions from across your workforce. So you can actually get a really good picture of the pockets of stress within your business. Is it because some parts of your team feel that they've got too many demands? Maybe they're finding any change initiatives you put in haven't worked for them, but it just gives you an opportunity to actually see, well, where is it? So you can target your conversations. So once you've got the hard raw data from the stress indicator tool, then it gives you an opportunity then when we talk about evaluating the risk is to go to your people and saying, okay, what does this mean to us? What else could we do? Because we know that if you engage with your workforce and you actually get solutions from them, you're more likely to get buy-in for the interventions. And when you record your findings, that actually going through that circle, that management standards approach, that gives you your risk assessment. And obviously monitor and review, go back around. And it's a very useful sort of process. Plan, do, check, act. You know, you can take things in a nice step-by-step approach. And there's lots of information about how you can do that in the data that you have behind the stress indicator tool. So we go into the next slide. So I'm going to pretend at the moment to be part of the University of Hull. A colleague couldn't be here today, but we've been working very closely with them for a number of years, and they've done some really interesting and innovative work on the back of it. I mean, you all know that since 2019, 2020, there's been a really significant change in how work is done. You know, there's more use of technology, more use of MS Teams, Zoom, you know, different levels of home working. There'd be more apps and different ways of actually interacting with our clients, with patients, with our bosses. There's lots of different ways. So what Hull wanted to do was to try and understand what this means for organizations, because we have the standard approach, which again is really helpful in terms of trying to understand across the board what the key areas of risk. But it's just going that little bit extra mile to say, okay, if we have home and hybrid working, and we know our people are maybe working more closely with different technology, what more do we need to do? So it's adding to it. So we want to go into the next slide. So how it was developed, it was developed as part of a project with the Future Work Design group, and initially started with a group of local authorities. So they built it on the back of obviously an extensive review of the literature, also looking at developing a scale, and they were then able to align the elements that they identified alongside the stress indicator tools management standards. So that will be the next slide. So as you'll see, we've still got demands, control, support, relationships, and change. But what the home and hybrid add-on has done is actually ask more specific questions about people working either in a hybrid or a home scenario. And the other add-ons for that, they add the work-home interface, because we know sometimes, although there's lots of benefits from working from home, there are also some downsides, and people not necessarily having that sort of commute to give them that sort of shift from work mode into home mode, and also managing how people manage their work and home life. Sometimes it can be positive, sometimes it could be negative, but also increasingly, and it's coming out in the literature more and more, is about remote monitoring and how technology has been used to identify when people are actually maybe logged onto their computer, how many keystrokes they have. And we know that there's some stressors involved in that. So this is basically what the home and hybrid working does. It just asking more specific questions that can help organizations where they do have people either working at home or in a hybrid function to make sure that you've captured all those elements that could potentially create stress for them. So we go into the next slide. So on top of this, I say where it fits with a stress indicator tool, it's a nice addition. It basically just asks another set of questions so we can make sure that we've taken into account new technology. But again, given the makeup of most of your organizations, as I said at the beginning, some of your colleagues will be working in life and death situations, working with some challenging service users, and often people will mask how they're feeling, whether they've slipped without diagnosis into anxiety and depression. So I should say that, you know, all those data that we capture through the SIT tool and the home and hybrid work, it is all anonymous, and you know we will have the raw data. But the PHQ-4, which measures how people's sort of psychological health, the anxiety, depression, that doesn't feed in. That's purely for Hull University's research projects that they're doing. We don't get to see that data, but what they do is that you went and decided that that's the thing that you wanted to tap into, then there would be another report that you get, and they would be able to give that with to you in addition to the stress management tool auto report, which you'll see shortly. But again, you don't know who it is. You'll just know that, you know, within your group, you have some people who are really struggling, and you really do need to make sure that you have put some additional resources in place. And it's all part of helping you manage the risk within your business, and recognizing that, again, you'll have really lots of different variety of people in different roles. And some people meet members of public, some people don't. Some people are going to be in life and death scenarios, some people aren't, but it just gives you a more holistic picture.